Welcome to our YouTube channel Menomics Made. Today we will learn about the vitamin A. There are three active forms of the vitamin: retinol, retinal and retinoic acid. Retinol, it is alcohol form of the vitamin A. Its main role is in reproduction. Retinal, it is aldehyde form or CHO form. Its main role is in vision. Retinoic acid, it is carboxyl group. Its main role in cell growth and differentiation. All three forms known as retinoid compounds. So you have to remember retinol, retinal and retinoic acid. It is known as retinoid compounds. Main form of retinol can be converted to other forms also. So you have to remember this much things for the active forms of the vitamin. Now we will learn about the all these three forms can be obtained from the animal sources such as eggs, fish, liver, milk and cheese. So you have to remember that all three forms of obtained from the animal sources. So you have to remember this much from this. It can be also the vitamin A can be also from the plant source like ripe mango, carrot. The form obtained from it is from plant source. It is beta carotene. So you have to remember these things for the plant source. Most abundant form of the vitamin A is beta carotene. Vitamin A is stored in cytosol. Most abundant form of vitamin A is beta carotene. It is MCQ point. So you have to remember these things. Now we will learn about vitamin A. It is absorbed in the intestine in the form of the retinol. In liver, it can be converted as retinol esters. Role of vitamin A in vision. 11-cis retinol, it is converted into rhodopsin. Opsin is added. It is in dark thing. Rhodopsin is converted into all trans retinol in the bright light. Opsin is gone and it is also reconverted into 11-cis retinol. So you have to remember this much role of the vitamin A in the vision. So you have to remember this thing. Functions of the vitamin A. It's in vision, rods and cone cells. Epithelium, it's growth and differentiation. It is antioxidant, reproduction, glycoprotein synthesis. In reproduction, germ cells and sperm synthesis. So these are the functions of the vitamin A. So you have to remember these things. Vitamin A deficiency disorder. It decreases vision, so night blindness. It can also lead to squamous metaplasia. So it can lead to dry eye. So it can lead to xerophthalmia. Xerophthalmia can lead to bitoid spots, and it can also lead to keratomalacia and corneal xerosis. Xerophthalmia is also caused to xerosis conjunctiva, and it can also lead to infertility. So you have to remember this much deficiency disorders of the vitamin A. Other places, respiratory tract, it loses loss of the mucociliary clearance, so it can lead to respiratory infections. In urinary tract, it leads to sending of the keratin debris, so it increases the risk of the stones. So you have to remember this much things for the vitamin A deficiencies. Now we will learn about the WHO classification of the vitamin A deficiency. X1A is conjunctival xerosis. It is first clinical signs. X1B is bitoid spots. X2 is corneal xerosis. X3A is corneal ulceration, or it is also called keratomalacia, less than 1/3 of the cornea. X3B is corneal ulceration. It is also called as keratomalacia, but it will affect more than 1/3 of the cornea. XS means corneal scarring. XN means night blindness, first clinical symptoms. XF means xerophthalmic fundus. So you have to remember WHO classification of the vitamin A, most commonly asked in the examinations. Hypervitaminosis can lead to acute and chronic things. In acute, headache, dizziness, nausea, blurred vision, stupor is seen. It is also called as pseudotumor cerebri. In chronic form, it can lead to weight loss due to anorexia, nausea, bone and joint pain. Retinoic acid, it will increase osteocytes, and vitamin A is also teratogenic. So you have to remember this much things for the acute and chronic form of the hypervitaminosis. So you have to remember pseudotumor cerebri. It is also called as acute hypervitaminosis. So you have to remember this much things. Thanks for watching this video. Please like, share and subscribe to our YouTube channel.